My name is Dr. Frank, and I'm actually showing you some exercises with the CLX. One of the reasons why I like it a lot is because it has loops. I don't have to play around trying to loop it around and tie things around, so I can get it quickly put on the patient and just perform the exercises. The exercises that I like to demonstrate really are putting the patients in a developmental position to actually facilitate a whole postural muscle chain synergy. So many of these exercises that I include with the CLX is not really isolated muscles, but to actually create a muscle synergy or chains of muscles in a kinetic chain. Those of you guys who are really working with pelvic floor patients like him, no, I'm just kidding. This is a good position to start them in. Make sure you put them in a really nice rib cage position. Do not allow it to actually arch up. So this is a good position to get the container, the abdominal bracing. Now the exercise is not straightening out the legs. It's actually lifting the sacrum up slightly. Whoa, 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 whoa. Okay, not so hard. All he's doing is trying to get his feet towards the ceiling. No, without extending the knees. Okay, you ready? I'll help you. Ready? Up you come. That's it. And let go. Now, as I'm doing this, I want to make sure he's not using his neck muscles either. So you got to watch it globally. So legs are out in abduction, slight external rotation, feet pointing up to the ceiling, and the exercise is just lifting very slightly. Don't push so hard, John. Okay. The purpose of this exercise is just lift gently. Okay? Bart, you make sure that I'm not looking down like this when I'm taking down. I'm just kidding. All right? This is one example. How is that?
It's good.
Good. All right, now, come on up. We have another position that's really good for serratus, for scapular work. Go ahead on your tummy. Okay, yeah, I'm giving you a big band here. And it's right here. Whoops, sorry, wrong one. Here we go. Right smack. And you'll see I'll wrap it around his scapula. Right. And here we go. And it's right like so. I'm going to position his scapula in a scapular plane and not right under the shoulders. You got it? And you can see here, if I put John in this position, his scapulas are adducted. It is not a good position, right? So what I want you to do is spread it out, like so. Okay, no. Okay, lift. Now all you want to do, John, I want you just gently push your elbows into the table. That's it. Perfect. Once again, relax. Don't try to lift your chest. Push on those elbows. Push into the ground, and you'll see that the scapula will start to spread out. Rather than, these are the folks that when you walk around, where the scapulas can actually crack the nut. We don't want that. So here we go. Push. So if it looks like a serratus push, like a dynamic hug, but the key is actually pushing through the elbows, right through there. Come on, John, hold it there. No lift. You gotta press into the table, that's it. Now, he's a real patient, so these are the cues that I'm giving them. You got it? Now, as he's in this position, I can guarantee you his abs are working. Now, if he's being sloppy, go ahead and be sloppy. He can hang out there forever. But go ahead and push your elbows in. Perfect. And this is one way you can actually get, I call it backdoor exercise. If there are patients of yours who cannot get abdominals to fire, this is one way you can get them to work. As he's doing there, you'll see the paraspinals are actually relaxed. Now go ahead and be sloppy. You'll see overloading of the paraspinals and compression in the lumbar spine. So do it the right way, push, not from here. Elbow, that's it. And you'll see the container. This is another example of a prone on elbows, but with specific, with basically precision, all right? Okay, that's good. One more. Shall we put you in another position? Come. You're going to go on your side now. I'm giving you guys examples of different developmental positions. Now, I'm giving John a black band because he can handle it, but in most of my patients, I actually put yellow or red bands. And what I'm going to do here, I'm going to put this very close to the humeral head. Wrap it around to create a external rotation. When he drops down, now I've got a force, it looks like a posterior glide, and external rotation assists. So far so good. And this will look like your Turkish get up. Bend your knees, please. You can either bend your knees or you can put your legs like this. Hang on. Here, put it like this. You can do it any position. Now, open. Okay. Now, the cue for this, I don't want John to be gripping the band. It has to be open. Now, I know if you have a kettlebell, you have to pull on it, but this is the band, you got to keep it open. So the cue, once again, is not for him to do a side bridge. It's actually push through the elbow. Come on, push through the, look at that. That's it. Push through the elbow, got him there, scapula. Now up you come. No, I want you to just reach up, and I can assist him. And then when he drops again, this is sloppy. Push on the elbow. That's it. So the difference between this is an external cue, versus telling him to bridge, is different. So the cue is actually push into the, that's it. And then he can play around with reach, push. So he's pushing and pulling at the same time. And if you see him from behind, his scapula will be spread out, not adducted. You got it? Okay, let's try again. Up you come. Good. Okay. And then now I can actually assist him with rotation. Okay, you ready? I'm going to help you. There you go. Don't lock your elbow. Okay? Now, there you go. Now I can create that. Now this is a really good scapular exercise. Rotate the cuff, stabilization exercise, and then come on up. Now I'm assisting him because John is caving in. He's dropping, he's getting tired. All right, here you go. And open hand, elbow, open, this, okay? So this is an example of, he has to reach for the biofreeze over there. There you go, good. Now, of course, from this position, if he can handle it, he can go all the way down into a plank position, right? And then come on up. There we go. And again. Okay? Relax. Good job. Tired?
Yeah.
Okay. In this position, open hands again. All right? I want to make sure John keeps a very good position. You see what he did before? It was all flex. So come on, drop, drop. This is how I beat up on my patients. No, I'm just kidding. All right? Come here. Long, long. There we go. You got it? So this is going to assist into external rotation. And John can actually do any exercises. Reaching. Come on, pull. There you go. And good. Excellent. And then you can try different angles. And then from here, can you go ahead and look up? Perfect. I can work with thoracic rotation. There we go. And then I want to, because John tends to kind of cave into his lumbar spine, I'm going to make sure he doesn't do that. Drop. You go. And then come on back down again. You got to keep it out here. And again. Good. Good. Okay, don't go so far. Okay, go again. There we go. That's it. You don't have much thoracic here. Come on, up. Good. And good. 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 And relax. So this is a good exercise if you want to try restore rotation. Okay, so here you can see, first of all, in this position, scoot over that way. I would actually prop John's arm. Put a little pillow here so he's actually in the scapular plane rather than stuck in the anterior glide. You got it? Okay. So let me just borrow something. Okay. Yeah, that's great. Okay. Yeah. Good. Okay. Now, what I'm going to do here, I'm going to loop it around the humerus. Thank you. What am I creating here? A inferior glide. All right. So because a lot of your shoulders, they tend to go into this position, I'm actually preventing it a little bit. And then here we go. Open again. Okay. You can loop it a little bit more, a few more times, and the exercise is this. And go. Once again, every time you do any exercise, you really have to watch what's happening here. John, let it drop. There you go. Okay? And I would recommend your thumb going out to facilitate more of the extra rotation. You can see the band pulling him into inferior glide. He's cheating. You guys see that? Those of you? Come on. There we go. Good. So in this position, you can actually give them a flex bar. Thank you. You can do proprioceptive work. You can be in this position. Can you do this? Yep. Okay. Okay. And then in different angles. So if you're treating and training a baseball player or overhead thrower, you can add the proprioceptive work with a good, to ensure good passive PICR in the shoulder joint. Okay. All right. Thank you. Thanks. So these are some of the examples that we can use the CLX. I hope you guys play around with it. If you understand the principles, just use it, okay, in the current practice that you're in. Thanks for stopping by.